Today is November 15th, 2023. Our patient is a 22-year-old female. The patient presents for nutritional counseling and their ID is 12345, and their chief complaint is dry mouth, or known as xerostomia. Okay, so thank you so much for coming in today and taking part in our 5-day food diary. So I just wanted to start off by reviewing your medical history and just outlining any diseases, conditions, or allergies that you may have, or any medications that you may be taking. So I do see here that you're taking Tylenol for frequent migraines. So we'll take a look at that and how it affects your overall health and your oral health. So Tylenol is also known as acetaminophen, and it can cause dry mouth if it's taken frequently. So incorporating water into your diet is very important. Just drinking water consistently throughout the day will definitely help with reducing that xerostomia. So I just want to start off by asking, do you drink water regularly? And if so, how much water do you think you drink on a daily basis? All right, so we've completed our intraoral and extraoral examination. So I just want to review the findings of those two exams. So the only thing that we found were a couple deep fissures on the tongue, and that could mainly be due to the dry mouth that you're experiencing. So that's also known as xerostomia. So there's no direct correlation um, within your EO and IO findings to your diet. That xerostomia is mainly due to the frequent intake of Tylenol. So I would highly recommend incorporating more liquids into your diet. That will definitely help reduce that xerostomia or dry mouth that you're experiencing, and it'll increase the salivary flow within your mouth. And we'll talk about salivary flow and the benefits of saliva a little bit later on. But right now, I want to talk to you about your caries classification. Caries is just another word for cavity. So you are at a moderate risk for cavities due to your daily sugar intake, and it seems like you drink a lot of caffeine and a few carbonated drinks throughout your daily life. So we're going to put you at a moderate risk for caries due to those reasons. So you also had a plaque score of 28%. Ideally, we would like our patients to be within a 15 to 20 range, just because that plaque buildup will definitely sit on top of the tooth, and it can lead to cavities and tooth decay. So we really want to reduce that amount of plaque that sits on top of our tooth. So we're going to go ahead and take a look at your dietary analysis recording form, and we're just going to look at your daily portions of each food group. So it looks like for proteins, grains, and dairy, you're doing really good on making sure that you get proper servings for those, so keep up the good work. However, we do want to try to incorporate more fruits and veggies into that diet, just because fruits and veggies are really good for our teeth, and it really helps strengthen enamel and reduce cavity development. And just getting more water into that diet will be very beneficial for you. So I want to talk a little bit about cariogenic food. So cariogenic just means that it's a food that can lead to cavities. So foods that are high in sugar, like donuts or sugary drinks, things like that are considered cariogenic food. Um, so the physical form of carbohydrates as well, and carbs are um, a lot of cariogenic foods have carbs in them. So carbohydrates can come in liquid form, solid form, whether it's hard solids or soft solids. Um, it can be sticky or tacky. It can also be retentive, which means that it just sticks onto that enamel. So I just wanted to review those different types of foods with you. So when it comes to cariogenic food, it's very important to think about the frequency that we're intaking those foods. So, the frequency of your meals and your snacks are really good and spaced out within your dietary form here, but I still want to touch on the importance of maintaining that frequency and just making sure that we keep up the good work. So when we snack less frequently, it gives our teeth time to be remineralized by calcium and phosphate. So snacking plays a big role in the formation of cavities. It's not so much how much sugar or how much cariogenic foods you take in, but more so how often you are taking those in and how frequently you're taking in cariogenic foods. So it's important to really space out our meals and try to limit snacking. And if we do want to snack, we can incorporate foods like fruits and veggies. That would be a really great thing to add to your diet, just because those won't add to the wear and decay of the enamel, because they're not cariogenic. Um, so, like I said, the more cariogenic foods you take in, or the more times you take those in, the less time your teeth have to be remineralized. And because you stated that you're experiencing xerostomia or dry mouth, I think it's even more important that we limit snacking, and focus on getting more liquids into our diet, just because that'll help our saliva flow a little bit better. And I have this um, picture here that just kind of talks about the importance of our saliva. So, um, our saliva has the ability to buffer acids in our mouth. Um, so that is very helpful in reducing and minimizing decay to our teeth. So, um, saliva also helps with carrying fluoride throughout our teeth when we brush or after we brush. So, there is minimal fluoride transport with um, less salivary flow. So we really want to work on that xerostomia with you and make sure that you're just doing really good with that oral health. So I know we've talked about enamel decay and cavities a little bit, but I just want to go in depth with the cavity or caries process. So in order for caries to develop, there needs to be bacteria, food, a tooth for it to stick onto, and time. And saliva is also in that mix. Saliva buffers, but with a lot of bacteria and plaque buildup, saliva can also harden, and cause tartar or calculus. So, this is the chart. Take a good look at it. Let me know if you have any questions regarding any of the things that we've gone through so far. So, after your full exam, we did put you as a gingivitis patient, um, with no perio involvement. So, perio or periodontal disease, that is related to bone loss, So we didn't find any bone loss for you, but we did find gingivitis, and that's just redness and inflammation of the gums, but it's completely reversible. So if we just keep up with our oral care and bettering our dietary habits, we can definitely reverse that and get you right back on track to being healthy. So I just want to touch on the basics of oral care, especially at home. So, brushing twice a day, which you've been doing really good with, and then making sure that we floss every single night will definitely reduce that gingival or gum inflammation and reduce that redness for you. And if there's any discomfort due to gingivitis, that'll also be very helpful. So, you definitely want to brush with a fluoride toothpaste twice daily and go ahead and start flossing. Um, and then, if you have any adjuncts or if using regular floss isn't very helpful for you, we can definitely try other things like floss picks. Those are um, very easy to use, and patients tend to really like those products, the floss picks. Um, and then I know I've said this before, but I just want to reiterate drinking water definitely will help, especially because you are taking a medication for migraines. So that's something that affects you on a daily basis. So I think it's very important that we also incorporate that water intake on a daily basis, just making sure that we're staying hydrated. Um, that will be very helpful and beneficial. All right, so a great goal that we can set to try and meet at our next appointment is for us to incorporate fruits and veggies into our diet and to intake some more water, and definitely try drinking water after meals and after snacking. If you really do want to snack on those cariogenic foods, if you drink water right after, it'll minimize the decay and bring your mouth back to a regular pH level so that it's not too acidic and wearing away that enamel. So now that we're all done with our appointment, I just want to ask if you have any questions for me, any concerns, um, and then, you know, I will is there anything that stuck out to you during this appointment? Is there anything new that you learned or anything that you would like to go over with me again? Please feel free to let me know, ask any questions. Um, all right, well, thank you so much for coming in today. I really appreciate it. Um, and then after we're done with speaking to our patient and going over the nutritional um, analysis, we would go over our rationale and our results and put those into our notes and just make sure that we document everything.